So I'll end this portion of the meeting and we'll move into the public testimony. So I have two here. One is Gene Crail and Richard Cohen. So Gene wishes to stand up to the microphone, and I give Richard Cohen will be on the way.
Mr. Barnum, members of the commission, thank you for the permission to speak to the commission today. I represent the New Hampshire Emergency Nurses Association, and many of the previous speakers have already talked about us quite a lot and how expensive of a place we are to get care. But I do want to remind you there is one more expensive place, and that is when we can't take care of you and get you well enough to send you home from the emergency department, we may have to send you to critical care, which is also known as the expensive care unit. And those may be the patients with asthma, the patients with high blood pressure, the patients with diabetes that you've already heard about. I find it very ironic that if you do disregard your health because you don't have the money and you don't treat your diabetes, your asthma, your high blood pressure, and you have a massive stroke or a heart attack, or you end up on dialysis and you're disabled, you'll then qualify for government-sponsored health care. So we would like to prevent that, and I have an example of a patient that doesn't fall under that chronic category yet, but a patient just seen this week by a colleague of mine in the New Hampshire Emergency Department, a young man who works as a landscaper. He works every day, works full-time, works for a small private business, does not have health insurance. He has Lyme disease, pretty common occupational hazard for those who work outside. The treatment of choice for Lyme disease is doxycycline. It's $380 for 10 days worth. He can't afford that, so he will be getting amoxicillin, a less expensive and a less effective treatment. Thank you.
Thank you, Mr. Chairman, members of the Commission. My name is Richard Cohen. I'm the Executive Director of the Disability Rights Center, which is New Hampshire's federally designated protection and advocacy agency for the past 35 years. I've been practicing in the disability rights field for nearly 40 years, I would say, the majority of the time in the state. Today, I want to briefly speak about the need for Medicaid expanding coverage for direct support workforce to provide care and support to individuals with disabilities and frail elderly. There are over 16,000 individuals in New Hampshire who make up this vital workforce at any given time. Those employed in state or county institutions and facilities such as the state hospital, clinics, and nursing homes have health insurance. Ironically, however, as the state has moved to a less costly, more humane community-based system, health insurance and other benefits have not been afforded to many of the direct support workers in the community. This despite the fact that the demands and the importance of the job have not changed, and if anything, have become more complex. Similarly, the importance of attracting and maintaining skilled staff to do the job remains just as critical. In terms of numbers, in the developmental services area agency system, for example, most of the 2,000 plus direct support workers have no insurance coverage. The same is the case for direct support workers and other systems. Sadly, many making poverty wages for this important role would be eligible for expanded Medicaid coverage. Others who are just above the poverty level would be eligible for insurance in the marketplace exchange. Health insurance will benefit this group of very deserving citizens in all the ways it benefits all of us. Providing them coverage and therefore access to health care will also address other critical needs. These needs have been documented in a number of reports. The vacancy rate amongst healthcare workers is as much as 30%. The turnover rate is as high as 74%. A major reason cited is because of lack of adequate compensation and health insurance. Continuity of treatment is ruined as a result of this incredible turnover. We have low-skilled individuals who aren't able to provide the kind of treatment that people need and are relying on. Medicaid coverage will allow us to attract a better workforce and provide better treatment for individuals with disabilities. And so we can meet an important state and societal obligation with minimum or no cost. So we think this is another compelling reason and a value added to expand Medicaid to this certain group. Thank you.
Thank you very much, Mr. Cohen.
Closer.
Opportunity, and you want to see the so I know the ways. I'm I'm James, I'm a physician in Hampton, and I'm 27 years as a writer for medical school residency. As a young research assistant at Mass General, I trained in health and healthcare services at private medical school that health insurance provided to me. My son Anthony just graduated with his master's and started school in Cambridge next Tuesday. He uses health and healthcare benefits in the state of Massachusetts. So for my son and myself, it's a wonderful bridge to a very important, very dangerous gap. When I first started practice, I noticed I was seeing my Medicaid children, I was seeing my Medicaid grandparents, and I wasn't seeing all the uninsured adults, the parents of their children. So I'm insured parents, but not uninsured. When we do a little further research with members of our community that have issues with the HIP coalition, we discovered that it was people on the beach primarily that do not have access to healthcare, so we started making a free clinic. My private practice has 2,100 people in it. The Hampshire Free Clinic has 400 to 500 people in the winter that we care for. The costs are one of our members of the community and very generous donations. The demographics may surprise you a little bit. They are all working people. They have no access to health insurance. They work at minimum wage jobs, and in the wintertime, frequently they don't get full-time pay. So, with those things in mind, you have to understand that these people are really the human grid of the infrastructure of Hampton Beach and Hampton. There are people like them in every single town in the city. The human grid of our infrastructure, they certainly deserve that opportunity. The health care that they need to be able to be active, healthy members of the community, taxpayers. I'm going to take 2 seconds to represent a sample. If I can just paraphrase your question, it was, why are we all on Medicaid? On Hampton Beach, I can speak to the fact that they are unaware of it. They sometimes don't have the literacy and education to sign up for it, and they have to continue to sign up for programs. That gets lost when they have gas money to get off the beach. The Medical Society earlier said that we appear to have capacity for over 200 people this year. I respectfully disagree from my small anecdotal point to say that I'm a dinosaur, I'm a solo physician. There aren't going to be many of me left in this world. Many physicians, if you try in this room to get a physician, you're going to have trouble finding someone who's open. And many physicians have part-time practices, or they do only certain times a year. I do agree with the Medical Society that we do have the capacity. I've seen that 75% of primary care physicians are employed in large groups, and I think you're going to have a much better chance of working with large groups as opposed to the dinosaurs. It's a big gap. Please mind it up.
Thank you very much, Dr. Hennessy.
Thank you and good afternoon. My name is Nancy Johnson. I'm here representing the American Lung Association in New Hampshire. I am here today to speak in strong support of extending Medicaid to thousands of New Hampshire residents. I will be brief. I have this testimony in writing. I won't read it to you, but there are points I'd like to make. The expansion of Medicaid means somewhere between 50,000 and 60,000 residents would get health insurance. Now, they are scattered all over the state, but if they were in one city, it would be among the largest cities in the state. How many people in this uninsured community think they are just out of shape when in reality they have undiagnosed chronic lung disease? Lung disease is the third biggest killer in the state of New Hampshire. Without treatment, these people surely end up in emergency rooms or in the hospital. And hopefully it is in early stages. Prevention is always more humane and cost-effective than treatment. Early detection can lead to a significant reduction in limitation of the functions of daily living. We estimate that lung disease may affect over 10% of the population that would be covered under this proposed expansion. We urge you to support Medicaid expansion and provide them with a life-saving benefit that the vast majority of us in New Hampshire already enjoy, and many of us just take for granted. Thank you very much.
Thank you, Dr. Johnson. Larry Ron will be next.
Thank you, Mr. Chairman. I am Representative Tom Shamber, District 4, Merrimack County. As a state representative of the towns of Sutton and Lowmont, I have residents whose economic needs are still not being attained. many working part-time jobs, but they're not achieving their wants. They want to have health care protection, but are not financially able. Many of these families are one illness away from bankruptcy. There are 15 families in my district that have turned their want for medical help to a pharmaceutical company for prescription assistance to meet their need for 196 different prescriptions. The second role I serve as a representative is in my position as a member of the House Ways and Means Committee. And what I see is Medicaid expansion as a fiscal plus solution for the state to accomplish expanded Medicaid. This is not a moral position. It is not a partisan position, but a fiscal position for the uninsured and the underinsured of New Hampshire. The Lewin Group Phase 2 report, January 2013, has a 63-page analysis of expanded Medicaid, with savings in state programs between $67 million to $113 million. Another economic effect of New Hampshire comes from the March 2011 report by the New Hampshire Center for Public Policy Studies. New Hampshire's smart manufacturing high technology sector is the economic engine in this state, employing over 80,000 people and paying an average wage of $1,200 a week. In a BIA online survey, healthcare costs are the most significant competitive pressure when BIA companies consider continuing or increasing production at New Hampshire-based facilities. In closing, former Governor and United States Senator Stiles Bridges, a Yankee Republican and not a fan of big government involvement or President Roosevelt's administration, accepted federal money after the tremendous March 1936 flood. To assist citizens, employers, and businesses, he called this money an opportunistic contribution to improving people's lives. Senator Bridges did continue to obstruct when citizens of New Hampshire needed financial help from Chicago. The Medicaid expansion under the Affordable Care Act is a fiscal savings approach to our state budget. It will have measurable fiscal impact on laws, persons, and taxes of our citizens, and its fiscal impact on the economic engines of our state. Please consider Medicaid expansion under the ACA as an opportunistic contribution for New Hampshire citizens. Thank you.
Thank you very much, Representative.
Thank you. Thoughts in support based on the experiences of my family. Some 150 years ago, during the trials and losses of the Civil War, my great-grandfather, John Dalton Brown, ran a pork farm over north. He would first hand the cost of care to the poor and needy. He was also a shrewd Yankee farmer who understood the value of the dollar. And I began to wonder what he would think about Medicaid expansion and what a dollar buys. Try this math. If Medicaid expansion costs 0 cents on the dollar for 3 years and 10 cents on the dollar the next, that's 4 years of access to medical care for 2 1/2 cents on the dollar. If the cost goes up, we bail for free. Think about it. What Civil War Yankee farmer named John Brown would refuse free bail and access to health care? Truth is, there is no easy humor for health care. There's no one here who cannot tell their own stories of illness and loss. For me, that story is simple as weary and as devastating as early death. My son-in-law had health insurance at work, was still dead at 36 in 1 year and 10 months under the lymphoma. Medicaid helped my daughter rebuild her shattered life. Medicaid was the difference between waiting through the night with my granddaughter, sobbing in her arms, waiting for the eardrum to not rupture, versus the access to medical care and prescription that saved Nora's hearing. What will you do for the New Hampshire child who is 5 generations out from that true Yankee farmer? The child who is no one from your family, no one from mine. We can act now, and we can buy hope for 10 cents on the dollar. We can do nothing and pay full price for health care.
Hi, my name is Ken Norton, and I am Executive Director of New Hampshire, the National Alliance on Mental Illness, a non-profit and non-partisan organization dedicated to improving the lives of all people affected by mental illness. Thank you, Chairman Marty and Commissioners, for the opportunity to speak in support of Medicaid expansion. 1 in 5 people have mental illness, and the Surgeon General in the U.S. indicates that 50% of those do not ever receive help or treatment. And that includes our veterans in the same rate. 50% of our veterans never seek help for psychological injuries. The impact of not seeking help or delaying help is lost productivity and wages, it's homelessness, it's incarceration, it's poor health and related outcomes, and it's even death. Suicide in New Hampshire is the second leading cause of death between the ages of 15 and 34, and it's the fourth leading cause of death between the ages of 34 and 54. 90% of the people who die by suicide have mental illness or substance use disorders, many of them undiagnosed and untreated. The reasons for not seeking care or delaying seeking care are many, but they include shame and stigma. They also include the cost and the lack of health insurance. As we've heard from earlier testimony, we are in a very serious situation with our current mental health system and the pressures on emergency departments and inpatient care. And the solution to that is more community-based services, but it's really about early detection and treatment of mental illness and substance disorders. Medicaid expansion would take a giant step in the right direction. It will reduce costs of highly costly services like emergency departments. It will improve outcomes, and it will save lives. And my written testimony is available, and it also includes a report from NAMI National about the benefits of Medicaid expansion. Thank you very much.
Thank you very much.
Thank you, Mr. Chairman and Commissioner, for allowing me to testify. I was grateful my jacket back on because I was afraid I'd never be able to take it off again. Just before you start the clock, there's a question from Senator Stiles about reimbursement. I understand there's a lawsuit in Oklahoma dealing with Section 1310 of the Affordable Care Act that says if it's not a state exchange, you can't get reimbursed. So I might want to check into that. And Senator Gilmore, good question. I had one group report, and it's been quoted here. It looks like a great report. There's a lot of concerning information about it that might need to be looked at when we finally come up with a final decision. I'm going to be one of those few people that say this. I understand there are people here that are concerned about health. I think the cost of health care has gone up so high that no one can afford it. And when you combine it with the fact that there's so many people that lost jobs, I serve on the labor committee in the House of Representatives, that exacerbates the problem. So we have a situation here where I think everybody's thinking that expanding Medicare is going to solve all the problems. Hell, I'm wondering whether or not it's going to help you lose 20 pounds and grow hair on me. But I'm not really sure if that's the case. But one thing that I want to bring to the Commission's concern is that the current budget that we passed just recently by bipartisan vote was actually short $50 million. There were cuts in the back of it that no one knows where they're going to come from, but we had a balanced budget. Now, from what I understand, the 10% of this additional money for Medicaid expansion that we're going to come up with when it goes to 90% is going to be about $75 million biennium or $150 million by the year 2020. I don't know where we're going to get $50 million, and I certainly don't know where we're going to come up with $150 million. Now, the conversation is that, well, there'll be savings in medical costs. Well, I don't know of any doctor that's going to be taking a cut in pay. And the statistics are showing that they're actually not taking Medicaid patients to the tune of about 20%. So there's a lot of challenges to you folks. And I'm not discounting what people say because I know these are genuine hardships. Because right now, with the economy that we have, I think New Hampshire and all the other states are stealing. But I don't know where we're going to come with the money. I really don't. And my concern is that this may be the camel's nose out of the tent that maybe institutes and the money is not there. Thank you very much.
Thank you very much for your comments.
My name is Monica Flora, and I'm from Greenland, and I'm providing comments today on behalf of AARP and its 245,000 members in the family state law. We support this because between the ages of 45 to 64 are deeply concerned about having affordable health care as they age. Expanding Medicaid would help approximately 13,876 pregnant savers, 45 to 64 years of age, who have lost their jobs, who are struggling without health benefits, and don't currently qualify for Medicaid health coverage. An analysis of the American Community Survey data by the Urban Institute shows that 7%, or 9,713 of the 13,876 people aged 45 to 64 in New Hampshire are the poorest of the poor and have incomes at or below 100% of federal poverty level. These individuals will not qualify for any tax credits through the health insurance marketplace, even though their income is below that of others who will qualify for tax credits. This is because the Affordable Care Act is written, assume that Medicaid expansion is going to be mandatory for the states, and that anyone under 100% of the federal poverty level will qualify for Medicaid. An unintended consequence of Medicaid expansion being optional for the states is that individuals below 100% of the federal poverty level will not be able to get affordable health care if New Hampshire is going to stay in Medicaid. For example, an individual with an income of $8,840 could pay 96% of income to get health care coverage. Someone earning $25,000 would only have to pay 691% of their income. We ask that you please consider this unfair consequence as you deliberate about the expansion of Medicaid in New Hampshire. Thank you for giving this opportunity just like that.
I'm Representative Jill Schaefer from Peterborough, and I want to talk about a particular group of friends, women like myself, 15, 60-something, pre-Medicare, who were divorced, post-family sort of, trying to work on careers, some of us self-employed, struggling to get health insurance, and finally giving up because at our ages, the premiums just keep going up. So over the last decade or so, that's where a lot of the attrition in small, individual small business coverage of health insurance has been happening. We've just been priced out of the market. I had a public option as a state rep. I can buy into the state employees plan. My friends don't have that. Some of them are running small businesses where they're self-employed, like an interior designer. Some of these women are working part-time as substitute teachers. In the current economic climate, they are not able to find full-time work, especially full-time work that has health insurance. Some of these women may actually be qualified for Medicaid expansion. If they aren't there, then they'll probably get health insurance through the exchanges. But this sort of is an answer to Senator Sanborn's question about how could the uninsured still be the same number when you expanded Medicaid. It's because people have been losing employer-based health insurance through this whole time. And just as another example, my own son and daughter-in-law moved back with me after they finished school from Boston. My son had a full-time job down there, making $10 an hour. They couldn't afford to live in Boston, but they had health coverage. So a plan like Romney Care certainly works down there.
Thank you for the opportunity to be here this afternoon. I'm Dr. William Sharrock from Hillsborough District 1, towns of Hampshire, Hillsborough, and Windsor. I also come as the chair of the board of the Hampshire Citizens Alliance for Action. Health care is a critical concern for all residents. Health care should be available to all. It is not available to many in this country and to many in our state. It is a travesty that this should be so in this country and state. It is unbelievable that all the first world countries, and even many others, that this country barely fails its residents in this regard. One of the means of supplying health care is through the Medicaid system for low-income residents. This system provides health care for a large segment of the population for whom it would not otherwise be available. Yet in New Hampshire and elsewhere, this program could expand to cover a large segment of the population who cannot presently afford ready access to health care. The proposed expansion of Medicaid in New Hampshire to provide coverage to an estimated 86,000 residents. This can be done with minimal cost to the state. Arguments or reasons given should be half heard or will hear Wednesday afternoon why this cannot or should not be done are purely diversionary and irrelevant to the great basic need to expand the ready availability of health care to all.
Thank you, Chairman and members of the Commission. My name is Megan Steele, and I represent the New Hampshire Public Health Association. We are in support of expanded Medicaid. We have provided written testimony on behalf of our President, Maureen Mulroy, and we would like to exceed our time for other individuals. Thank you very much.
Good afternoon. My name is Clara Molnier, and I'm from Rochester. I represent the AARP and its 225,000 members. I do not believe that Medicaid expansion will solve the medical problems or the healthcare issues in New Hampshire, nor do I believe that it will solve our budget problems. I do believe it will help those people 45 to 65 who do not qualify for Medicare. Many of them have lost their jobs or are working in relatively low-wage jobs and do not make enough money to purchase health care that they need. 45 to 65, you do need health care. I believe Medicare expansion will save lives. I believe it will reduce the need for emergency room care, a very expensive option. I also believe it will reduce the waiting lines in emergency care. I also believe it is a step in the right direction. I believe the first step was the managed Medicaid system. That was very important. The second step will be this Medicaid expansion, and I hope for a better healthcare system for this state, for all of us. Thank you for the opportunity of speaking. I have testimony to submit.
Thank you very much. I forgot to who was in.
I'm a police call from Ryan, New Hampshire. I'm here as an AOP volunteer and share the union's work position on Medicaid expansion. I would like to make 4 points. One of the things I am also is a full-time unpaid caregiver for my wife who has Alzheimer's. I'm also a facilitator for a men's group for men whose wives are afflicted with Alzheimer's. In that connection, I'd like to address 4 small points that I think have been mentioned very much in the vast meetings and presentations that the committee has heard. The first is that the CEO recently issued a report indicating that the economic value of the unpaid caregivers for 65 and over exceed that of all the paid long-term care services for all adults in all settings and all payers combined. This indicates to me that the families of the caregivers are taking responsibility for their health of their other family members and not relying on government. We're in a government setting, there's a focus on government, but this indicates to me that the private sector is doing as much as they can. I've got 30 seconds to hit the last three. One, demographically, caregivers are declining as the population moves into people who need caregiving services. Caregivers also experience greater physical, emotional, and financial hardships, and therefore we're losing the multiplier effect of having unpaid caregivers support their other family members without reaching the door. And personally, in reference to Alzheimer's, research is all focused now on early detection, which is the segment I just mentioned, the 45 to 64 group. Detecting Alzheimer's at that stage delays the benefit, delays the impact of Alzheimer's and those effects. If we all live long enough, we all have dementia. So it's coming for almost everybody in this room, sooner or later. So the longer we can delay that people can test it, the better off we're going to be. In New Hampshire, we have 22,000 people diagnosed with Alzheimer's. We have 4,000 beds. That means there's 18,000 unpaid full-time caregivers, probably more, as they split that time, who are looking out for their other family members. Thank you for allowing me to make this presentation. I will submit the full report to the committee.
Thank you very much.
Chairman Byron and members of the commission, my name is Sherry Byron. I'm a resident of Goffstown, and I'm also here as a volunteer advocate for AARP. I am the face and the voice of women aged 50 and over who are college educated, unemployed, uninsured, and single, living in New Hampshire, who are family caregivers to one or more family members. In 2008, I was divorced. I was unemployed. I was uninsured. My unemployment compensation had ceased. My savings were depleted. I was close to homelessness. I had exhausted all possible sources of help. I was a caregiver for my dad, who had Alzheimer's and Parkinson's diseases. I also became a full-time caregiver for his wife, who was diagnosed with a brain tumor and required surgery. She no longer could care for my dad. I would be caring for both of them. I used to wonder what would happen if I had an accident or I was diagnosed with a serious illness. All three of us could possibly have ended up in nursing home at a cost of $225,000, $250,000 per year, if anything had happened to me. If I'd had Medicaid insurance coverage at the time, we all would have slept a little easier. I ask the Commission to please consider the recommendation of Medicaid expansion for single individuals aged 50 to 64 who are just trying to survive. Thank you, and I have that testimony to provide.
Thank you very much.
Mr. Chairman, members of the committee, I'm John White from Wolfboro, and I speak on my own behalf. I have heard a lot of arguments against the proposal to expand Medicare, but I have yet to hear any really rational arguments. But in the rhetoric leading up to this, I have heard a lot of irrational talk, and that's what I would like to address today. It seems that the antipathy to President Obama, which has frozen the wheels of the legislature in Washington, is now blowing a chill breeze through the halls of government in New Hampshire. And I would ask you, if you would leave 58,000 New Hampshire people uninsured and uncared for because of antipathy to the president, shame on you. If you would spur $2.5 billion, our taxpayer money, and this economic stimulus in my money, just because of antipathy to the president, shame on you. If you would leave us burdened with 58,000 uninsured, depending on a rickety, insubstantial safety net, dependent on the public purse because of antipathy to our president, shame on you. I would ask those who object to this very rational plan to examine your conscience, look deep in your heart, remember what you have heard today, and do the right thing for all of New Hampshire, not just those underprivileged. Thank you.